Hi guys, my name is Julia. Welcome back to my channel. Today I will be talking about the different types of nursing visits in home care. So a revisit is a patient that's already on services. We already started the starter care and now the nurse goes in. We teach medication management. You teach a patient about disease management. If they're diabetic, for example, you teach diabetes management, how to check their blood sugar. You want to make sure that they know how to give themselves their insulins. You teach diet, you teach exercise. There's a lot of stuff that these patients, they don't know, especially for patients that are newly diagnosed. There are a lot of things that they don't know because remember that they are not medical professionals. We have to teach the patients and we also have to teach the families. So a lot of times when we make our visit, we want to make sure the family member is there with the patient. This way the patient can know, what to do, and they have, someone else who already was teachable for us to, to be able to teach them how to care for themselves. So we teach disease management. We do medication management. A lot of patients, they don't know their medications. They don't know the side effects of their medications. So there's a lot of teaching in home care, and in revisits, we do a lot of education, a lot of teaching. For revisits, we also do a lot of treatments. So we have wound care. Sometimes we do wound vac. Sometimes we do Plurex drains. Sometimes we're removing staples. Sometimes we're doing Foley catheters for men and women. Sometimes we're doing flushes. We're flushing Foley catheters. Sometimes we're doing drain care. We're doing nephrostomy tube care. It's a lot. It's a lot that goes into a revisit. So that's basically what that revisit is. We do education, and we also do a lot of treatments for revisits. Okay, so that's it for revisits. Now, a resumption of care is for a patient who was previously on services, but for whatever reason, the patient went to the hospital and was admitted and now returned back to home care before the certification period ends. Once they return back to home care before the certification ends, we do a resumption of care, which is similar to a start of care. Then we have a recertification. So a recertification is done in a patient who is currently in services, but their certification period has ended and the patient still needs services. So for example, if we're taking care of a patient wound and the wound is not healed, then we have to do a recertification for the patient. This way the patient can continue getting their wound care. Okay, so I did revisit, I did a resumption of care, and I did recertification. Okay, so a start of care is basically an admission. So when you do a start of care, you are doing a comprehensive assessment of the patient condition, and you want to set up that patient for all the services that they're going to need throughout the time that they are on home care. It's very important that you do a thorough assessment on start of care. So after completing this comprehensive assessment, which is usually done by a registered nurse, okay, the nurse should be able to determine the types of disciplines that the patient may need. Sometimes the patient needs more than just a nurse. Sometimes the patient may need physical therapy, occupational therapy. Sometimes they need a social worker or any other disciplines that's needed. Okay, so at start of care, it takes a lot of time because there's a lot that goes into a start of care. Okay guys, that's it for today. Thanks for watching. If you like the information I provided, please give me a few thumbs up, comment down below, let me know if you have any questions. Remember to subscribe to my channel, and thanks for watching. See you next time.